something I know that was also mentioned that you were studying in this chapter, and these are really important to know. Talking about anatomical positioning, the point of reference to describe your body. So I didn't include a slide on anatomical position, but really it's very simple. How you want to be able to describe these terms is based off of something called the anatomical position. And the anatomical position is when a person is standing straight up with their face, palms, and feet forward. So basically, like if you were, I don't know, at least I did this as a kid, when you'd lay on the ground and you would let someone trace your body with chalk on the sidewalk. You'd want to lay kind of like that, but you'd want to be in that standing position, and you want to make sure your palms are faced forward and they're down by your side. So regional and directional terminology, again, is going to refer to more terms that you would use in a healthcare setting, and it can be kind of hard to understand them all at first. But here is my tips on the best ways to study these terms. So practice instead of just reading. It's like a math test, right? When you were learning to do your math facts, or if you take in algebra or statistics or some kind of collegiate math course, you have to practice how to do the problems. You can't just read the book. I mean, I'm sure maybe some people can, but the majority of us have to actually sit down and learn how to do the math. If we want to understand how to do it, doing examples helps us understand. Same thing in this case. Practice. Think about where things are located on your own body. Try and picture using these terms based off your own body rather than just reading examples from a textbook. And this mainly is only important when considering the regions of your body, which I believe I put on here last. But I want you to remember that you'd often hear teachers in school, you have a teacher presenting, but a class facing them. Your left is my right. You kind of have to think about that when you're thinking of regional terms. Remember that the left and right sides are going to be flip-flopped if you're thinking about your own body when you're facing a diagram. So if I have this paper sitting right in front of me and I'm looking at it, the left side of the paper is actually going to be my right side. Like it's going to be flip-flopped. So just consider that, especially if you're taking the lab with this course. You'll do some labeling in your lab for your lab exams, and you will have to make sure that you pay attention to which side is actually left and which side is actually right. Okay, so let's go over some of these terms here. So here's some directional and orientation terms. I also have a print off of all of this information that I will send out. Okay, so superior. Superior is going to be referring to towards the head or the upper part of a structure. Cranial, it's often cranial. So an easy way to think of superior is in terms of cranial. Your cranial, your cranium is your skull, which you'll discuss more later. It is towards the top of your body. It is the tip top of your body. So superior is the top. Think of superior, how it's used in social status. The king is superior to the peasant. We'd say something like that. Superior meaning better, meaning higher. So superior is at the top. Cranial is at the top. So the example they have here is the head is superior to the abdomen. All right. Inferior. Inferior or caudal. So the term caudal, I don't know if you know this, but caudal means tail. So we have cranial for superior, top, caudal for inferior. If caudal refers to tail, wouldn't that mean referring to the bottom? Think of your coccyx or your tailbone. That's towards the end of your body. So inferior is away from the head. It's towards the lower part. So we have superior, inferior. We could say in social status that the peasant is inferior compared to the king. The king is so great, so mighty, so superior, he's high. The peasant is lowly, he's inferior. So the navel is inferior to the chin. Navel is referring to your belly button. So your chin, below your chin is your belly button, your navel area. So it's inferior. Your navel is inferior to your chin because it's below. So one thing to note between inferior and superior is that it's not used for arms and legs. You're not going to say that your shoulder is superior to your fingers. No, you can't say that because these two are not used for your limbs. So it's only used for the main trunk of your body. So you can refer it to your head down to your waist, but you can't discuss it or use this terminology with limbs, arms and legs. Now we talked about ventral and dorsal already. Ventral is your anterior side, dorsal is your posterior side. Remember my little turtle illustration? Hopefully that makes sense to you. It made sense to my mind. It might have made more sense because you had a turtle, stuffed turtle in class, but your ventral side is your front and your dorsal side is your back. Okay. The example they have here, the breastbone, so right down the front middle of you, is anterior to the spine. Spine is in your back. Your breastbone's in the front, so we could have said your breastbone is ventral to your spine, it's anterior to your spine. Other way around, dorsal. The heart is posterior to the breastbone. It's towards the back, posterior, past. Okay, and then we have 3 terms of medial, lateral, and intermediate that all kind of go together. Medial, think of middle, think of median. Driving down the highway, the median is in the middle. So median is your center line straight down your body. The heart is medial to the arm. Well, think about it. You put out your arms, your heart is in the middle. Medial is middle. Lateral. So when we think of lateral, we need to think of away from the middle. So we can have 2 lateral sides. We can have your left and your right arm, but both are going to be lateral to your chest. Lateral is meaning towards the outside of the body, away from the middle, away from the midline. Intermediate, okay, kind of in the middle. We think intermediate. Some middle schools say intermediate schools, middle, more between the middle and medial and lateral. So medial is always middle. Intermediate is in between lateral, so all the way out at the end of your arm, compared to medial, which is in the middle. Intermediate is somewhere in between. It's like we have elementary school at the end of your arm where lateral is, and then intermediate, middle school, high school, and the medial part. So we work our way in. So intermediate is in between your lateral and your medial. So example here they have is the collarbone is intermediate between the breastbone. So your breastbone would be right in the middle, and your shoulder. So collarbone's kind of somewhere in between the two. Intermediate is referring to the middle of the 3 terms, and that's where it's confusing. Medial is meaning the very middle of your actual body, but intermediate is meaning the middle of lateral and medial. Pointed out lateral and medial. So if you had a body here, just again for one last emphasis, we would have lateral out here towards the end of the arm. And here we would have intermediate. And then in the center of your body, you'd have medial. Again, I think the best way to practice those is just thinking about it using your own body, or maybe even if you don't like using your own body, printing out just a diagram or a illustration of a person so that you can point to them and say, well, this is how this relates to that, using these terms and definitions and checking your definitions. Again, I'll send you this paper with the exact examples on it if you would like. A few more, proximal and distal. So here's what we are going to remember here. We talked a little bit about a short while ago about superior and inferior. You do not use them for limbs. Distal and proximal are only used for limbs. So that's where it's different, and that's where a lot of people are going to make mistakes or do make mistakes on exams and tests and assignments. Proximal and distal are only used for limbs. Proximal and distal you use for your arms and your legs. Superior and inferior you use for the trunk of your body. You use for the middle of your body. So proximal, when we think of proximal, we say sometimes that's in close proximity. It's close to us. It's in close range. So proximal is referring to the closer to the origin of the body or the point of attachment of a limb. So, where your shoulder is the attachment of your arm to your body, to your trunk, to your main part of your body. Your legs your hips are the point of attachment for your legs to the rest of your body. And that's what that's referring to. So here it's saying the elbow is proximal to the wrist because the elbow is closer to where your arm attaches, your shoulder attaches to the main trunk of your body. It's closer. It's in closer proximity. It's proximal. Distal refers to farther from the origin of a body part or the point of attachment of a limb to a trunk. So the knee is distal to the thigh. Why? Because the knee is further away from where your leg attaches to the trunk or the main chunk of your body. We have your knee is farther away from your thigh. Your thigh is very close to your hip where your leg attaches to your body, to your trunk. So again, proximal and distal are only used for limbs. Now, superficial and external. This means towards the surface of the body. So think of external, we think of exterior, so the outside of a house, your exterior part of your house. That's like your siding, your windows, everything outside. Same thing with superficial, towards the surface of your body, kind of what you can see. So for example, here they have the skin is superficial to the skeletal muscles. We don't see our muscles, we see our skin. Our skin is superficial. We don't see the couch in the living room, we see the siding or the porch when we drive by. Same type of interior, exterior, internal, external type of deal. So superficial is just meaning towards the surface. So superficial, surface. 2 S's, keep them together. Deep is internal, away from the body, more internal. So the lungs are deep to the skin. The lungs are more internal. They're in the interior of your body, whereas the skin's on the outside. So the lungs are deep to them because they're further back. They're more internal. All right, so that's more of the directional terms you're going to discuss. We have the planes. The best way, I think, to kind of go over this is point them on yourself. Sagittal plane cuts you straight down the middle, cuts you right down the nose. Transverse cuts you in 2 halves, across the hips. Coronal, or you can hear frontal plane. It cuts you straight down the middle of the brain. So all of these are cutting you And I like this illustration here. They're all cutting you 50-50, but just in different ways. So we have our sagittal plane. Here it cuts you straight down the middle of your body, right down your nose. Transverse plane cuts you straight across your hips, 50% above, 50% below. And then your frontal is different than your sagittal because your sagittal is cutting you straight down your nose, whereas your frontal would be cutting you like in the middle of your ear, the side of your body. So all ways are cutting you 50-50. There's just 3 different ways that we mainly can divide the body into a plane. And those are important to know as well. Body cavities. So we're looping back around to that like I said we would. Body cavities. So we have dorsal body cavity. So it has 2 subdivisions. We have the dorsal body cavity, which has the cranial body cavity and the vertebral or spinal body cavity. And then there's also another body cavity type, which is the ventral body cavity. So ventral meaning front side, and it also has 2 divisions. So we have the dorsal. So here's kind of your first, that was a terrible one. This is your first main body cavity, and it has 2 subcategories. Again, we have vertebral body cavity, vertebral referring to vertebrae, spine, contains your spinal cord. You can kind of think about this again in terms of the turtle shell. The turtle shell is on the back. We said the dorsal side was the back side of the turtle shell. The back side of your body is your spine. It's kind of like your shell. So your vertebral cavity contains your spinal cord, and your cranial cavity contains your brain. And that is what makes up the back side of your body. And you can think about that really. If you look at your own body or think about how, think about your head all the way down your spine, the things on the back side are really just those bones and your brain. Now the second division is this ventral body cavity, which again has 2 subdivisions, the thoracic body cavity and the abdominopelvic body cavity. So here we have the first division of the ventral body cavity. We have the abdominopelvic cavity. This contains your, houses part of your digestive organs, and the abdominal part houses organs for reproduction, and the pelvic part, the lower part. So again, this is even kind of divided up. We have your abdominal organs up here and your pelvic muscles down here, but it's all classified together as the abdominal pelvic cavity, which is part of the ventral body cavity. Again, ventral meaning front, the front side of that turtle shell we talked about. And you think about your own body in the front. Yes, your pelvic, your abdominal organs are towards the front of your body, so it makes sense they're on the ventral side. The second division of the ventral body cavity is the thoracic cavity. And your thoracic, when you think of thoracic, it's really referring to your chest area. So your heart, your respiratory system, lungs, that's all what's contained in your thoracic cavity. Again, it makes sense it's in the ventral or anterior division of between the dorsal and ventral, because your chest is on the front. It's on your ventral side. So again, that's just your all the parts of your heart, lungs, things of that nature towards your chest. So, quick review: dorsal cavity, cranial cavity, and vertebral cavity. So it's like you have 2 divisions of cavities with more subdivisions. So the first one, we have dorsal cavity, backside, cranial, vertebral. Second division, we have ventral with thoracic and abdominopelvic. All right. So this is where I was saying that the left and the right side are going to come into play. With your left is my right is your left, that sort of deal. So if I'm looking straight down or you're looking straight down at this pelvic, just to get this squared away, we have right hypochondriac region. It says right, but to me and you, that's our left because we're facing straight forward. So you'd have to, turn around and then say that's your left. So especially when it comes to your lab exams, you'll have to make sure you're looking at which side's actually left, which side's actually right, if you're comparing it to your own body. All right, so there's two ways that they will typically classify your abdominopelvic cavity. You can do the regions. So A here shows the abdominopelvic regions. Sometimes they'll talk about quadrants. A lot of times you'll hear regions, and I think specifically on the test or the quiz, I feel like they might refer more to the regions, but do not quote me on that. So it's important to know kind of a rundown of what is in each quadrant or region. So let's talk about this. So right hypochondriac region, right side of your, towards your ribs. What's in that? What is in that region? We have, part of your liver, your kidneys, gallbladder, part of your large intestine here. So those would be what ride in the right hypochondriac region. Epigastric region, right below your sternum, this bone being your sternum, right below your breastbone, sometimes you'll hear it say. Your liver, your stomach, your spleen, part of your adrenal glands, those can all be found in the epigastric region. Now your left hypogastric region. So your left side, we have to think of your stomach, again, pancreas, kidney. That would be more in the left hypogastric region. Right lumbar region, okay? The right lumbar region, your ascending colon, your small intestine partially, your part of your right kidney could be found in there. Lumbar, we think of lumbar. I know you guys haven't covered this yet, but lumbar is towards the lower part of your back, your lumbar region. So again, we're not all the way down low, but we are, the right lumbar region will be getting lower on your body. So a good way to remember lumbar is by that. Umbilical region here in the middle is easy to remember. Umbilical, think of umbilical cord, belly button, navel area. Where's the baby have an umbilical cord? Where is your belly button at? Right around where that region is. Now your duodenum, your small intestine, your parts of your transverse colon or your large intestine are all found in that umbilical region. So that's really a lot of your digestive system is found in your umbilical region. Now your left lumbar region, again, lumbar, lower back. What's found on that side? Your descending colon, your left kidney, your small intestine. Again, a lot of your digestive organs are found right here in the middle. Right iliac region. Okay, iliac. Again, I know you haven't studied this yet, so it might be harder to remember this way if you're not really familiar with bones and parts of the body yet. But iliac region, when you think of iliac, I automatically think of hip because that's a part of your hip bone, your pelvic area, right through in there. So that's an easy way to remember. Your iliac region is the lowest possible quadrant. What's in that region? We have your appendix. We have your small intestine, your ascending colon. Hypogastric region, there in the middle. So we have the umbilical region, which had a lot of your digestive system. A good way to remember your hypo. Hypo means below, so it's very low. So that's a way to remember it's in the bottom. And don't get epigastric and hypogastric confused because hypogastric, remember, means low, under. So it's going to be lower. And what's down there is your bladder, some of your reproductive organs, and those types of things. Your left iliac region, again, part of your colon, small intestine, is found in this area. So that's the 9 quadrants of the abdominopelvic region, or sorry, the 9 regions of the abdominopelvic regions. If we move over to B, where our quadrants are, we have our right upper quadrant, left upper quadrant, our right lower quadrant, and our left lower quadrant. Again, the organs are going to be in the same order, obviously, but this just divides it up in quadrants instead of worrying about nine regions. I'd really focus on the regions. I think that they are used more commonly because they're more specific than the quadrants are. And again, the best way to practice these is by imagining yourself in this situation, or looking at some kind of diagrams and then quizzing yourself, I think is the best way. I made a few examples of exam questions that, might be asked. I tried to come up with a few here to kind of just get you in the mindset of how your exam might be set up. So let's just review them here. The lungs are blank to the skin. We talked about all those terms. We talked about the lungs. The lungs are they're inside of you. Your skin, you can see it on the outside. So your lungs are going to be deep to your skin. They're more internal. Remember, superficial means towards the surface, but deep means they're more internal. So the lungs are deep to the skin because they're more internal. The blank plane divides the body into an anterior and posterior portion. So to answer this question, we need to remember what anterior and posterior means. Anterior means towards the front. Posterior means towards the back. So if we want to divide it between a front side and a back side, which plane was that going to be? We'd have to cut down the ear, cut down this side, and if we refer back to what that was, is the frontal or the coronal plane. Either would be correct. The elbow is blank to the shoulder. Okay, we have our elbow, we have our shoulder. What 2 terms can we use? Do we use superficial and, superior and inferior, or do we use distal and proximal? Remember, for limbs, we always use distal and proximal. The elbow is further away than the shoulder, so it's a farther distance. It's distal. So if it's further distance away from the main part of the body, it's distal. And again, remember, superficial is not used for your limbs. It's not used for your arms and legs. Now, the final one, the nose is blank to the mouth. Nose, mouth. Do we use distal and proximal, superficial and inferior? Well, here we just said superficial and inferior are not used for arms and legs. So this is not referring to arms and legs. It's referring to the nose and mouth. It's part of the face. So we can use superficial because, remember, distal and proximal are for the limbs. And that's just a technicality you kind of have to memorize and practice with to make sure you familiarize yourself with.